Okay. All right. So this is a presentation called Literature Review of Pityriasis Lichenoides after the COVID-19 vaccination. All right. So just a quick recap. I did a presentation on a patient who suffered from Pityriasis lichenoides, or PL. I'm just going to call it PL from now on, after his COVID-19 vaccination. And this prompted me to do a PubMed search on other possible cases of PL after the COVID-19 vaccination. All right, so the next few slides are from my previous presentation. It's just to give you a quick refresher on what PL is, as well as the diagnosis and the treatment. So pityriasis lichenoides is a rare autoimmune skin disease that presents as a spectrum of about 3 different forms. So we have pityriasis lichenoides veriformis acuta, or pleva, pityriasis lichenoides chronica, that's the chronic form, and febrile ulceronecrotic Mucher-Habermann's disease. And that's the severe form of things like joint pain, fever, and chills. Now, the PL presents as crops of asymptomatic red oval-shaped papules on the trunk, upper extremities, and buttocks. All right, and lesions heal with various forms of hypo and hyperpigmentation. So the exact cause is unknown, but one possible cause could be an inflammatory reaction to a vaccination. And there have been multiple cases of PL following the COVID-19 vaccinations. So the diagnosis is generally clinical and is confirmed with a skin biopsy. A skin biopsy will show a lymphocytic infiltrate, focal parakeratoses, papillary edema, and vascular alteration of the basal layer. Now, last time I went through the histology of each one of those with you guys, but I'll spare that this time. All right, so a literature search was done using PubMed's advanced search, and the search term pityriasis lichenoides COVID-19 vaccination was entered. Studies published between 2021 and 2024 were selected. Okay, so for inclusive criteria, the article had to be in English using human participants, and the skin rash had to be specific to PL and not another cutaneous manifestation. And the vaccine had to be one of the COVID-19 vaccination and not another vaccination as well. Now, and also we had to make sure that the subjects developed PL following the COVID-19 vaccination, and that was just to make sure they didn't have PL prior to being vaccinated. All right, so the search yielded about 14 results. 4 of the results were eliminated because they dealt with multiple skin reactions, and the remaining results were case reports of PL following the COVID-19 vaccination. So the case reports were compiled into a table, and they listed the following. So as we can see here, we have the age, okay? We have the sex of the patient, the vaccination type, the presentation, and the latency. Now, the latency was the time from the first COVID-19 vaccination, or the first dose, to the onset of the rash, okay? So I'm just going to go over 2 of the cases that I found were interesting and kind of noteworthy. If I went through all of them, I mean, we would be here for hours. I mean, you can look right here. This is a lot of cases. So I'm just going to go over 2 that I thought were kind of interesting and noteworthy. So the first case is a case of a 16-year-old male who developed asymptomatic reddish papules on his trunk about 7 days after his first COVID-19 vaccination. CBC, liver function, kidney function, and inflammatory markers were all normal, and serology for Hep B, C, HIV, and ONCA antibodies were all negative. And here's a picture of his rash right here. As you can see here, it's kind of on his trunk, and they're kind of oval shaped and a little red. All right, so a skin biopsy confirmed the diagnosis of PL. Shout out to my fellow pathologists. And the patient was started on doxycycline and UVB photolight therapy. And what makes this case noteworthy is the fact that it's the first reported incidence of PL following the COVID-19 vaccination. As you can see here, we have the histology of the patient, okay? We have papillary edema. The dermal papillae are thick. They're edematous, okay? And right here, we can see the lymphocytic infiltrate right here and all along here. And if we look down here, we see vascular alteration of the basal layer. And that's these kind of little white circles kind of all throughout the basal layer. You can see that. Okay, so the second case that I found was interesting was an 81-year-old male who developed pruritic rash on his upper back, shoulders, and neck. And he got these about 9 days after his first COVID-19 vaccination. So once again, CBC, liver, and kidney function were all normal, and serology for Hep B, C, HIV, and syphilis were negative. And here's a picture of the rash here, as you can see, kind of on his shoulders, his neck, and his upper back. And it's interesting that they tested for syphilis because, I mean, I suppose it kind of looks like syphilis, but that generally is on the palms and hands or palms and soles of the feet. So, I don't know, that's kind of interesting. So the lesions eventually transformed into ulcerating lesions over the next 6 weeks. As you can see here, here's a picture of the lesions. Ooh, that looks pretty bad, you know. And the skin biopsy did confirm the diagnosis of a PL, and the patient was treated with prednisone and high-dose topical steroids. He did report a resolution of the rash after about 5 months of treatment. Um, and that's a really long time, you know. I mean, that's like half a year, 5 months, you know. And I mean, he's already 81, and he doesn't have that much time left, and he has to live with this rash. I mean, that's pretty tough. All right, so let's just go over the table. All right, so as you can see here, for ages, we have a large variety of ages. We have all the way to 16, all the way to 81, and then everything in between. So it's a large variety of ages. Now, for sex of the patient, a lot of them are males, which is interesting because PL is an autoimmune disease, and we classically associate autoimmune diseases with females. Now, one of the things I will mention to you is that PL in general has a male predominance. So males, for some reason, tend to get it more than females. No one knows why. I tried to look up to find the reasons why, and it basically said no one really knows. I did try to run a t-test on my samples, and it came back saying there weren't enough samples. So that was unfortunate. Um, Now, for the vaccination type, we see a lot of these are the Pfizer vaccination, okay? And for presentation, a lot of them are the acute form. You can see the A here is for acute, okay? And some of them are the chronic form. Again, C for chronic, okay? And then for the latency period, the average latency was about 10 to 15 days after the first dose of vaccination, okay? So, common features, males, Pfizer vaccination, and a latency period of about 10 to 15 days. All right, so many of these were cases of patients that developed PL after the COVID-19 vaccination. Therefore, getting a recent vaccination history is very important for any patient with a rash similar to PL. And that's simply because it could be a reaction to the COVID-19 vaccination. So PL has similar characteristics to other skin rashes. Therefore, it's very important to be able to distinguish it to prevent a misdiagnosis. Um, if I mentioned to you before, I mean, the 81-year-old that we saw, that rash, I mean, they tested him for syphilis because they thought it might be syphilis, you know? So it mimics other types of rashes, you know? Now, it does resolve with treatment, okay, which is basically topical steroids. So reassurance is extremely important for patient care. So the two recommendations that I can give any clinicians or anyone who's watching this are get a good vaccination history and provide reassurance. Those are two very important things for patient care. So some limitations of this are the small number of case reports, as well as how new the COVID-19 vaccination is. And further research needs to be done on the exact causes of PL and its possible associations with the COVID-19 vaccination. Now, just a disclaimer, this should not discourage anyone from getting the COVID-19 vaccination. It's simply an unsightly skin rash that does resolve with treatment, versus COVID can be lethal. Oh, and there are my references.
Thank you so much, Dr. Singh. Do we have any questions?